Something I find fantastic about Verita Life is that you combine different treatments depending on what the patient needs. With IPT, how does that work?
IPT, it stands for insulin potentiation therapy. This is more, let's say, an integrative therapy by combining conventional and alternative together. The conventional part of it is using the chemotherapy. The alternative part is to make it suitable for the patient without giving them any severe side effects as what chemotherapy does.
So it's a little bit of both, a little bit of conventional and a little bit of alternative put together.
Exactly. Yeah. So the idea behind this treatment, it came a long time ago, that when it was discovered that sugar is the main source of energy for cancer. So the idea came, what if we lowered the sugar levels in the blood? What would happen to the cancer? Here it is, the insulin is playing two roles. One, or let me say first, we are combining chemotherapy with insulin. The role of insulin at this part is going into two parts. One, it's that it's lowering the sugar levels in the patient's body and putting the cancer putting the cancer under metabolic stress, right? The cancer becomes more weak, it's starving, it cannot resist the chemotherapy or decrease the resistance of the cancer towards the chemotherapy. The second part is that cancer cells, they have insulin receptors on the surface more than any other healthy cells or other cells, which attracts sugar to it. So when we inject the insulin, insulin is binding with these receptors and as if it's marking or targeting the cancer cells for the chemotherapy. So at this time we use a low dose of the chemotherapy, which varies between 10 to 20, 25% of the conventional dose. At this time here we have a greater effect of the actual dose that has been given with very low side effects.
So correct me if I'm wrong, so first what happens is the insulin goes in.
Exactly.
And then the cancer cell is hungry. And then while it's hungry, the glucose and the low dose chemotherapy goes in, and because the cancer cell is so hungry, it sees the glucose available, mixed in with a bit of low dose chemotherapy, and it will grab it.
Exactly.
And that means that it's basically medicated itself with the chemotherapy.
Exactly.
And I suppose that would then be a way for the chemotherapy to target the cancer cell rather than other cells of the body.
Definitely. And now the thing is also with not every time we use the glucose, because there are certain chemo drugs which has glucose already inside it.
Okay.
So that's what sometimes make the cancer attract the chemotherapy in a conventional way. So this is always, it is making the cancer, as you said, hungry, starving, and then giving it this low dose, which makes it become very weak, and the results could be greater than the dose that is given to the patient from the chemotherapy. The insulin is always calculated according to the patient's body weight and to their blood results. So we first, if we're going to talk about the procedure, first is the patient's blood sugar is tested before we give the insulin dose, and then we give it, the insulin works for about 30 minutes at this stage. So within these 30 minutes we are monitoring the sugar level until we get to that level where we call it the metabolic stress. And then we would give the patient the chemotherapy.
So what you're calling metabolic stress, we might see it as a very hungry cancer cells.
Very hungry, very weak, very, let's say, irritated cancer cells. So here is, it becomes
that's the opportunity to then
for the chemotherapy to penetrate and go inside and kill the cancer.
I mean, compared to your normal conventional treatment, how much chemotherapy is actually going in?
It's always, we start with 10% and then we go up to maximum 20-25%.
So a lot less than conventional treatment.
Much less of the conventional treatment.
And I imagine then that means that there'd be a lot less side effects.
Definitely. We don't have the major side effects of chemotherapy, conventional chemotherapy, as loss of hair, as, let's say, depressed immune system, mouth ulcers, and so on. So we don't have these. Of course, it is a chemotherapy. It will have very minor side effects, but the patient doesn't feel these side effects. We can sometimes see these side effects on the blood works, sometimes maybe elevated liver enzymes, but it's not elevated to a point that it is dangerous. All right. And what we do in Verita Life, we have a protocol for every chemo drug. So what we can do is, what we do usually is that we give a chemo protection 1 day before and 1 day after, in order to help the bone marrow to produce more healthier cells. protect the healthy cells from the chemotherapy as well. So the side effects are even more less with this.
I feel like IPT is such a fantastic example of using, conventional treatment and alternative treatment together.
Definitely, yes. And it is more, let's say, trying to get the best outcome of both treatments for the patients.
Okay, thank you.
You're welcome.